Hello, Kin 28ers. This is Dr. Cosby. This will be your online lecture for the physical conditioning portion in our actual syllabus. So it will replace the actual in-class lecture, which should have been today. I kind of start off this lecture every year with the question that you see in the bottom left-hand corner, which is really what is off season, right? When you think about it, if any of you are student athletes, then many of you would kind of say, oh man, I recall never having an off season, right? This idea that there really isn't an off season, particularly if you're a serious athlete, a skilled athlete. What we know is that you no longer just engage in only preseason and in-season competition, but that you really are doing this kind of year-round conditioning process. If you're not in competition, then you're trying to stay in shape or you're trying to stay strong for the next season. So there's been this huge shift from athletes who just participate in the competition to a year-long 365 days out of the year kind of physical conditioning that's expected of particularly collegiate level and professional level athletes. So as we progress into this lecture, I think it's important to talk about this idea of stress being good or bad. And there are different types of stress, right? There's physical stress, there's emotional stress, there's all other kinds of stress. But the two we're going to talk about today are the two that probably impact your population the most, which would be physical stress, which is the type of stress where we place a demand on the body, and then emotional stress, which is the type of stress that can essentially lead to breakdowns in the body, right? So what we know is that although overload stress or that physical stress is critical in training, right? It absolutely is. It leads to strength gains. In some patients, it might lead to endurance gains, which is important for our distance runners, and conditioning. The stress, what we know about the stress is that it must not be great enough to produce injury, right? Does that make sense? And we're going to operate off of this idea of the SAID principle. And I'm going to define what SAID principle is. The S stands for specific, and then the A stands for adaptations. Adaptations, I can spell. The I stands to imposed, and then the D stands for demands. So it's this idea here, which is stated in this paragraph, which is our body has the ability to adapt, right? It's a great adapter. An example of the way the body adapts is moving from cement to grass to sand, right? Our body is able to adapt to the different terrains that we throw at it. Similarly, our body is able to adapt. Like if we are on a trampoline, our body's able to adapt and allow us to absorb some of the shock coming from the trampoline itself. So our body has the ability to specifically adapt to the imposed demands that's being placed on it. And that's a good thing. But when when the demand is too great, right? Then what we see is that the body will stress out because it's an overload and it can't handle the amount of stress that's being placed on it. And so when we talk about this idea that if the stress is too much, then it's going to cause injury. Another scenario is when the stress isn't enough. Does that make sense? So we don't apply enough of a stressor. Then either we don't see strength gains or we don't see endurance gains. So the ideal situation in physical conditioning is that we apply enough stress to the body to cause some type of change. That change could be the ability to run for a longer distance. That change could be increase in actual strength. It just really depends, right? But what we don't want to do is not apply enough stress so that we don't progress in our sport, or we apply too much stress and it leads to injury. So we want to be somewhere in the middle. So always remember that specific adaptations to impose demands. We have a few potential coaches or athletic directors in the room, so this becomes hugely important for your coaching staff to know. Out of season, there are certain things we don't want to do. In season, there are certain things we don't want to do, and preseason, there are certain things that we don't want to do, so that we don't see this spike or this increase in the number of injuries among our athletes. So we're going to talk about the principles of conditioning. And so when we think about periodization, or this idea of periodization, it kind of goes back to that question of what off season. What we know about periodization is it's kind of this year-round approach to conditioning. And I actually really like this approach, because what we realize is that most of the injuries that we see in most sports typically happen when athletes take an off season, so they do absolutely nothing, and then they come back too soon, too fast, right? And then we see a spike in injury. So this idea of periodization, a year-round approach to conditioning that involves organizing all components of training into carefully sequenced phases, is hugely important to reducing the amount of injuries that we're actually going to see. And so when we think about periodization, it's this approach to conditioning that kind of attempts to bring about a peak in performance. And most often that peak we want to happen when? In season, right? We want that peak in our athletes to happen in season so that they're most successful. If they peak too soon, then they aren't as successful. If they peak too late, then it's the end of the season, and what good is that peaking, right? And so we want to keep these things in mind. Periodization in general is going to organize a training and conditioning program into cycles, and we're going to kind of talk about those cycles. But the other thing that periodization does is it really takes into account that every athlete may have different training and conditioning needs. So there's this kind of individualized approach to the way that we see conditioning for our athletes, right? And we can think about this from, I probably know the sport of track and field and basketball best, but we could think about this from like, okay, you have a point guard and you have a center, right? Those individuals most likely probably need different training programs, right? Your point guard's going to be running the ball up and down the court, so they're going to probably need more short kind of sprint types of conditioning programs, whereas your center, they just need to make it down the court and post up. And so they may need more long distance type of training to prepare them to do that. So periodization, year-round approach, we want to treat every student athlete as an individual, or every client as an individual, and we want to take these individualized needs into consideration as we consider the programs that we are creating for my strength and conditioning coaches or coaches in this class. So what we typically do is we're going to break down the seasons into kind of phases of training. Those phases are termed differently depending on what website you look at, but there's off season, not really off, preseason, and in season. And this really is a continuum, right? That kind of goes ebbs and flows. In other words, as soon as you finish in season, you go back to off season, which is really physical conditioning, and after off season is preseason, and then in season. And so it's this cyclical process. It's not really linear in nature. And the goal, obviously, in physical conditioning is that we set our student athletes up to peak in the in-season phase. What we typically know is if we're training them correctly, what this leads to is reduced injury. And I think that's the goal of any athletic trainer, any physical therapist, any strength and conditioning coach, any exercise physiologist. That's the overall goal. And so this is one way to kind of do that. So when we're thinking about periodization training, we have, like I said, 3 seasons to kind of consider. And we're calling the off season, but the reality is we don't have an off season. Yeah. When we're thinking about off season, we're thinking about this as the preparatory period. We're getting them ready to be successful in preseason, right? So this is going to be very unstructured. You want this to actually be pretty fun. Most times what we often see is that it's not anything related to the actual sport itself, right? Because we want to give them a break while at the same time maintaining the physical conditioning that they had in the in-season part of the physical conditioning process. So again, it's very unstructured. Some student athletes might show up, or clients might show up, some may not. It often involves some aspect of cross training. The goal of this is to do what? To reduce the demand on the body, to give it time to recover from the in-season portion of their physical conditioning. It's very low intensity. It's high volume for sure. And like I said, it's non-sport specific, to give them a break so that we don't see this thing called athlete burnout. Your preseason is going to be your power phase. So this is where we're going to load them a lot. So it's going to be high intensity, high weight, but what we're going to see is that they're not going to do much of it. During this time, it begins to get a little bit more structured, right? Because now we're preparing them for the in season, but this is a power phase. So we're going to load them, right? We're going to try to improve their strength or their endurance so that they're successful in the in season phase, of activity. So the in-season phase is considered the competition period. During this time, we're high intensity, we're low volume, but the big deal is that we're sports specific in our skill training, right? And so this becomes important because you can see this progression from unstructured to very structured. You can see the progression from low intensity to high intensity. And so as they get into the in-season phase, what we're going to do is taper off. They're in season, so the goal is for them to peak. We set them up to peak in these periods of physical conditioning. So this off season, like I said, it's something that we kind of want to reconsider. It's not really an off season. It's a time of physical conditioning where the athlete is allowed to kind of stay in shape, for lack of better words, while doing something that's non-sport specific and fun, but maintaining their physical condition that they gained in the in season. So as you can see, there's really no off time. Now, with that said, we do have some teams who give student athletes a week off or 2 weeks off, and then they kind of return back to the off season preparatory phase of life. So as we progress into the PowerPoint, we're going to talk about principles of conditioning as it relates to, well, how do we start and how do we finish? Every physical conditioning session should start with a warm-up. There's research to suggest that warming up properly reduces the risk of particularly muscle injuries, muscle strains. And so it's during this phase that we actually want to stretch. So you should do some type of warm-up. The ideal is a dynamic warm-up, right? So this would include maybe some type of lunges, some type of squats, right? Most traditionally, we've always thought as a warm-up, which just included some type of running, right? It should really include a combination of movements, so running. But what we also know is that lunges and squats also increase blood flow to the lower extremity. So that should also be incorporated in the warm-up phase. Additionally, we should stretch here to avoid increased risk for, in particular, muscle strains. And then we want to make sure that our athletes cool down, right? Most often what we see is when athletes are done or clients are done with practice or participation, what do they want to do? They want to go home. What we know is that if we don't cool down, then essentially that athlete, it could be at risk for injury as well. We want to consider the said principle. Remember, I said that was specific adaptations, right, for imposed demands. Okay, so what does this mean? I've already said it, and you're probably repeating it back to me. This idea that we don't want to apply too much stress or too little stress, right? If we apply too much stress, then we increase the risk of injury. If we apply too little stress, then the opposite happens. We don't see the changes that we desire. So we have to be very careful. We want to increase load slowly, and that increase in load should really be patient dependent, right? Whatever outcomes you might have will allow you to progress them the way that you need to progress. So again, there's this kind of individuality that happens when you're working on the physical conditioning portion with your patients. We have to think about progression, specificity, and safety. With progression, it kind of goes back to what I just said, that we're going to increase intensity, but we have to keep in mind the said principle when we do this. If we increase the intensity too much, we might injure something. If we don't increase the intensity enough, then we don't see the gains we want. So these, again, should be very patient dependent, right? We can't treat the team, everybody on the team the same, right? A 300-pound lineman and a quarterback aren't going to progress the same in a deep squat, right? So we have to be careful how we progress. Again, this requires work. If you have 50 student athletes on your team, you might be able to group some, but you won't be able to group all. So it's going to require work, but the work is worth it if you want to see great in-season results. Then there's specificity, right? This is where you get to the sport specific stuff, right? This is going to be the kind of the in season component, where you're focused on, if they're linemen, they're doing lineman drills. If they're quarterbacks, they're doing, drop backs and throws. If they're a jumper, they're starting to do more jump lunges. If they're a sprinter, they're starting to come out of the block. So you have to give your patients in physical conditioning some type of specificity specific to the actual sport. And then probably number one on the list is this idea of safety. Safety includes using proper technique. And that proper technique could be certainly in lifting. It could be in running. It could be in shooting. It could be in, I don't know. I mean, the list could go on. Whatever skill it is that patient or client has, you want to make sure that whatever they're doing, they're using the proper technique. What we don't want to do is have a patient using improper technique, because what we tend to see is they develop these faulty kind of patterns, and then we have to retrain them. So let's focus on safety and proper technique first, as we start to progress them and as we start to get more specific in their sport. So flexibility is an important component. Some athletes will argue with you about whether or not stretching is impactful and whether or not it actually leads to success in performance. I'm not here to sell you one way or the other. The only thing that I can tell you is what we know about improving flexibility and doing a warm-up and stretching is that it definitely leads to a reduction in injury among athletes. So there are different types of stretching techniques that you should be aware of. The first one we talk about probably is the last type of stretching technique that we should do, but it's the ballistic dynamic type of stretching. So this is going to involve repetitive bouncing. So an example would be like jump lunges. You could do like calf loads or calf bounces, but this is going to involve dynamic movement of the muscle group that you actually want to use. It could be jump squats. The big deal with this is to actually use caution. My recommendation is to do this type of stretching technique last, because then, at least then, what we know is that the patient is actually ready to rock and roll. Okay, so use it last. We have static stretching, probably the least functional of the two. This is where we have a patient we stretch them to an end point, and then we have them hold that stretch. So this is very static in nature, very opposite of dynamic, but definitely necessary, right? So this is going to be more of your static stretch. Yes, this will also be more of your static stretch. This is going to be more dynamic and ballistic in nature. And then last but not least, you have PNF stretching. This is going to require a clinician to kind of help you out, but it's the idea that the patient is going to be moving through the range of motion while the actual clinician is resisting them. And I'll show you when we walk into class what that looks like and what the differences are between the three different types of stretching techniques. But in order, this should be the first stretch you're going to do. If there's a clinician around, this should be the second, and then this should be the third type of stretch in order. This will lead to reductions in injury if you do it in this order. If you decide that you're only going to do ballistic and dynamic stretching, please make sure your patient has had a really good warm-up before you enter into that activity. Resistance training techniques. There are different types of ways to kind of train muscles. I think you guys are probably more the experts in the room than I am. So what we're going to do is really just kind of talk about those. The first type of exercise is an isometric exercise. So the patient is going to contract, but there isn't a change in length in the muscle. So it stays pretty static. These abdominal muscle exercises are a great example of that, right? You're holding that position. The muscles are contracting, but they are not lengthening and they are not shortening. They are staying in the same position. This is good for obviously core work. It's also good in the earlier phases of the injury because you're not taxing the muscle. But ultimately what you want to do is essentially transition into either isotonic or progressive resistive exercises. So your isotonic exercises are the exercises that are more common to us, the ones that we'll probably do most often when we go to the gym. So dumbbell, what am I thinking? Bicep curls, bench press. Those are all going to be isotonic exercises. However, what we have to consider is the concentric or eccentric nature of the actual contraction. And I'm glad I'm actually doing this online lecture because I can spend more time talking about these two actions than I ever have. So we're thinking about a concentric action. What we're thinking about is, how do we shorten that muscle? What does the muscle do normally? How does it behave normally? An example of that, let's use the biceps, okay? The biceps are elbow flexors. We know this, yes? So when the biceps contract, they flex the elbow. This is a symbol for flexion. So they cause elbow flexion. Does that make sense? This shortening of the muscle, this contraction of the muscle is a concentric action. Most often we think of most muscle action functions by their concentric action. But what we're starting to see is that eccentric action is just as important, and some would say even more important, to preventing or retraining after a muscle strain. In eccentric, we are lengthening the muscle under a slow load. So it might be, number one, that we do the shortening phase. So we cause the biceps to flex the elbow with a biceps curl. And then we, to do the eccentric portion, what we're going to have that patient do is slowly lower that elbow back into extension, right? So we're challenging the muscle in its weakest point. And it is this type of training that becomes important, because the muscle learns how to behave in a shortened position, but then also in a lengthened position. So in hamstring strains, in bicipital strains, a lot of times what we'll see is, certainly we'll see the concentric kind of training, but what we'll also see included in that training are the eccentric exercises. So that slowly lengthening of a muscle. Last but not least are progressive resistive exercises. Progressive resistive exercises are exercises that have been used to increase force production in muscles. And what we know about progressive resistive exercises is that, number one, these patients are going to perform a very small number of repetitions until fatigue. So it's like a fatiguing exercise. And then the patient has to allow for sufficient rest between the exercises for recovery. And then what happens lastly is they increase the resistance as the ability to generate force increases. So it's this progressive piece, right? What we also know is that there are recommended loads, which correspond to like this 8 to 12 repetition maximum, which are then to be lifted in like 1 to 3 sets. And you do this typically 2 or 3 days each week. So it's a little bit different than isotonic and isometric, because the goal is to get the patient to fatigue in these particular exercises. And what we know about them is that they really have been used by athletes to kind of improve strength gains. But you have to do this you have to educate your patients on the fact that they are going to feel fatigue, that they are going to feel more sore than they probably would with isotonic and isometric exercises, because the goal is really truly to kind of improve strength overall. With progressive resistive exercises, please keep in mind you are looking at repetition max, so it may be important to have the patient do their 1 repetition max first, and then figure out based on that what their treatment or their progressive resistive exercises will be based on their 1 repetition max. In terms of plyometrics, I love plyometric exercises. The concern with plyometric exercises really is this idea that we have to make sure that we're educating patients. When we think about plyometric exercises, these are rapid stretch exercises followed by an explosive contraction. So we really do increase the risk of injury in patients if they are not warmed up. So it becomes instrumentally important that they're warming up. So you can kind of see some of the exercises here, but let's go to the next slide where they really becomes clear what they are, right? So your patient is going to jump off of this step stool, stretch the body, and then they're going to land dynamically in a squat. This is just one exercise. You have other patients who kind of go out of a squat into a stretch position and then land in a squat for distance. This is most often seen in like your jumping athletes. It could be something more simplistic, right, as using the abdominal muscles and stretching them and trying to improve core It could be ladder work. There are lots of different ways to do plyometrics. The big deal with plyometrics is because it is so dynamic is to make sure your patient has warmed up. This concludes this lecture. I'm looking forward to seeing you guys in class. Make sure to wear something comfortable so we can do some of these physical conditioning activities and we can kind of walk through those and talk through those as a class. Hope you guys have a good rest of your week.